Kirstin's behind the counter.
Hi and welcome back to Kirstin's Counter. We are here today with a very special episode featuring the lovely, beautiful, and ridiculously intelligent Nurse Ann, who also happens to be my sister. And Ann has been a nurse in the hospital for the last 10 years, the last 8 of which in the ER. So my question to you today, Ann, is in your opinion, do you feel like antibiotics are overused?
Well, hello, and thank you for having me on your show. And yes, in my opinion, antibiotics are overused. Patients want to take them, and the problem with overuse of antibiotics is it can cause a resistant strain of bacteria, which can then cause a super infection.
So Ann, I noticed that in my opinion, when people come into my clinic, they oftentimes want to jump to taking antibiotics right away. Now, in your opinion, what is a good time to start considering looking at antibiotics as an option?
Well, a good time to consider antibiotics is if you have severe pain or anything lasting longer than 5 to 7 days. A good idea is to call your primary care physician or go to your local community health center and have a full evaluation. Antibiotics can be helpful.
Now, Ann, you work in the ER. In your opinion, what's the most common reason that people come into the ER or emergency room requesting antibiotics?
Well, the most common reason I see in the emergency department is upper respiratory tract infection. This could be a cough with sputum lasting longer than a week.
Like productive sputum?
Yeah, productive sputum, thick, yellow, just won't go away.
Not pretty.
Not pretty at all.
Right.
People don't like it, and it's a good idea to come to the emergency department or your regular doctor and just have it checked out because it could need antibiotics.
So now we're going to talk a little bit about viral versus bacterial infections and their uses with the antibiotics. So Ann, what are some good examples of viral infections?
Perfect example of viral infection would be the common cold, influenza, chickenpox, and HIV.
Okay, so now what are some good examples of bacterial infections?
A good example of a bacterial infection could be a urinary tract infection or strep throat.
So antibiotics really only work with bacterial infections, not so much with viral infections, correct?
That is correct.
Now, what are some of the side effects of either overtaking antibiotics or even just taking one dose of antibiotics?
Some of the side effects can be nausea, vomiting, diarrhea, dizziness, headaches, and for the ladies, yeast infection.
So ladies, you want to make sure to eat your yogurt. And I guess the moral of the story is before you go running to your doctor for antibiotics, you really want to make sure that you have your diagnosis right and it's a bacterial infection versus a viral infection. Otherwise, you're taking antibiotics really kind of for no reason and you're taxing your system unnecessarily, right?
Correct.
Nice. Well, thanks for watching Kirstin's Counter. Stay tuned next time and we'll have more guest appearances by the lovely, beautiful, and talented Nurse Ann.
Thank you.
For more information on herbs and foods and to be part of this health-tastic community, please come visit us at kirstinscounter.com and be sure to fill out a free health profile to get a better idea of your specific needs, patterns, and ideal formulas. Thanks for watching. I'll see you next time. Cheers.